Morning. I'm Lori Kirkendall, President and CEO of Medical Institute for Sexual Health. Our national organization was founded in '92 in Austin. I earned my degree in health education from A&M and have taught abstinence-focused education, or what we now call sexual risk avoidance, in Texas schools for 25 years. We lead a statewide SRA network reaching hundreds of thousands of Texas students each year. My favorite part of this work has been seeing the consistently strong, positive response of the students. They appreciate the relevant, authentic, clear, and supportive messages that protect their current and future health. Their parents also continually appreciative. I testified previously that for 20 years now, Texas's teen birth, abortion, pregnancy, and sexual activity rates all have fallen steadily and significantly. The health data simply doesn't support the radical redirection that has been called for. What has not fallen are STD rates and the mental and emotional and relational risks of early sexual activity. Different than 20 years ago, sex is far more dangerous for kids today. The proposed health TEKS are medically accurate, age-appropriate, and evidence-informed. They're relevant and desperately needed in today's sex-saturated culture. They are not abstinence only, as has been asserted and widely misunderstood, but rather they present a comprehensive set of needed knowledge and skills. They promote optimal health for all children in Texas, no matter their socioeconomic or family status, their sexual orientation, nor their past sexual experiences, whether they were chosen or forced upon them. And they're not political or moral or religious. They're simply founded on what's best for our kids. Thank you all for the very hard work, the very thorough review and updating process you've conducted this year. Texas's children and their families will be better served as a result. Thank you.
Ms. Kirkendall, she gave a lot of facts and information, which I appreciate, but were there any recommendations for specific TEKS?
Yes, there are several. I think a couple of them are just little housekeeping pieces. So we need STDs to have a slash before STIs. That needs cleaned up in there. There was a slip of consent in grade 7 and 8, that 21J. And then there's a cleanup on Health 1 there's the SE on contraception, where it talks about how they work and may reduce the risk. It just needs to be cleaned up so it doesn't require demonstration. So it would just say how they work to reduce the risk or how they may reduce the risk. So options on 21G, I referenced 7th and 8th grade 21J. And then also, I think we want to look at defining casual relationships. I think that one we can be cleaned up. All of these I've submitted to you in writing. Cleaning up legal implications. There were 3 of them sitting there at the end of 7th and 8th. I think we can combine those into 2. And then my last recommendation would be to insert a new SE in 7th and 8th and Health 1 that would look at prevalence of STDs. We've included a lot of nice information on STDs and prevention and all of their biology, but we haven't put in there the prevalence, which really helps young people understand their risk. So those 6 I've listed in the written testimony that I've submitted to you all. And again, we would continue to affirm the board's decision to not include consent nor differentiated instruction on LGBTQ.
Anything else, Ms. Cargill? Okay, Mr. Mercer.
For Ms. Kirkendall, too, my name is Ken Mercer, and thank you for participating again. You had said last time, and some data points, there were 3 of them: sexual activity, birth, and abortion, 20 years ago to what it is now. Could you repeat those 3? Again, it's sexual activity, birth rates, and abortion rates of teenagers.
Yes. So it's teen birth, teen pregnancy, teen abortion, and teen sexual activity rates. So a couple of snippets there. Texas campaign to prevent teen pregnancy cites that since '98, there's been a 65% decrease in pregnancy, or teen birth rate. Sorry, now I'm misquoting. Teen birth rate has fallen 65%. Guttmacher Foundation shows us the abortion rate's fallen 77%. Power to Decide, the national campaign to prevent teen and unplanned pregnancy cites it at 50% decrease in pregnancy. And then we watch sexual activity rates through the Centers for Disease Control, the YRBS, kind of the gold standard in teen health. And that also has shown that decline in sexual activity over the past 20 years. I like to look at the rates also of teen sexual activity coming up through 9th grade, 10th grade, 11th grade, and 12th grade. The far majority of high school students have not had sex in those earlier years, especially where we're talking about the health TEKS.
Comparing kids to their parents from 20 years ago to today.
Yes, and that's a national trend as well. So it's interesting because teen pregnancy, birth, abortion, and sexual activity rates are falling. As mentioned in my testimony, also STD rates are not. And so the complication there is the why. And I've given several reasons of that in my written testimony, but I think that just indicates that sex today for kids is far more dangerous. And then there's the whole mental, emotional, and relational risks we've got to look at as well that you all have included in the TEKS thus far.
My last question is exactly that, because I remember you mentioned last time how many, well, first of all, it should be STDs, STIs, or STD/STS.
It should be a slash. Those terms are really used interchangeably. In the field, Centers for Disease Control uses STDs. Others use STIs. They are the same concept. So the slash, it should be a slash versus the and. I think it was a clerical piece in this last version of the TEKS.
And my question was, I believe 20 years ago they had X amount of STDs, and how many do we have now? How many did we have before? How many diseases, infections do we have now?
Well, Mr. Mercer, I don't know if you're referencing, so in the 40s, 50s, 60s, and 70s, there were 2. Today, there are over 30 different STDs. Prevalence numbers can be found even by county in Texas, about a 25% increase. Syphilis, gonorrhea, chlamydia, all going up. A real concern actually is congenital syphilis. Over 100% increase in babies being born with syphilis. So looking at some of those trends, again, Texas Department of Health and Human Services, Health Services provides that information for us on a county and state level.
Thank you for your data. Thank you.